I'm going to teach you today how to use an incentive spirometer. I'm a registered nurse, and the reason I chose to demonstrate the incentive spirometer is because many patients benefit from using the incentive spirometer. The incentive spirometer is a medical device used to help patients improve the functioning of their lungs by promoting lung expansion. It also helps clear secretions from the lungs and help clear any anesthetics from the body. This means that an incentive spirometer measures how well you are filling your lungs with each breath. It is typically provided to patients who are scheduled to have surgery, to patients who have had any surgery that might jeopardize respiratory function, particularly surgery to the lungs themselves, but also commonly to patients recovering from cardiac or other surgery involving extended time under anesthesia and prolonged in-bed recovery. Patients who use the device have faster recovery and shorter hospital stays. Use of an incentive spirometer is equally effective and capable of reducing the risk of postoperative complications by 1/2. So that would mean every 50 out of 100 patients would recover with no complications because of the use of an incentive spirometer. It can also be used as well by wind instrument players who want to improve their airflow because its primary purpose is to promote lung expansion. There are several parts to the incentive spirometer. This is the handle. This is the volume target, and you can measure your volume target with this indicator here. It's an adjustable mark to indicate a goal, and on the right side is an indicator showing whether the patient is inhaling too rapidly. The flow rate guide helps you to maintain slow, deep inspiration when the guide is kept between the arrows, or you'll see this good, better, and best plunger, and it moves as you inhale. The tubing port connects the expandable tubing to the device when it can be stored in the mouthpiece holder. And I have my co-worker, Tyler, here, who is going to help me demonstrate how to use the incentive spirometer. You typically can sit on the edge of the bed or as far up as you can if you can't sit up. You hold or place the incentive spirometer in the upright position, and you breathe out normally. Put the mouthpiece in your mouth and tightly seal your lips around it. You breathe in slowly and as deeply as possible, raising the white piston, in this case, toward the top of the column. The yellow indicator should be in the blue outlined area. And you hold your breath as long as possible, at least 5 seconds, and then allow the piston to fall to the bottom of the column. So, ready? And you want his target volume for his height and weight and age is 3,200. So Tyler's going to try to hold that piston at 3,200 for 5 seconds. 1, 2, 3, 4, 5. Good. And typically they want you to use 10 breaths. After each set of 10 breaths, then practice coughing to be sure that your lungs are clear. Most often, once the patient is able to get out of bed, walk in the hallway, and cough well, then they may stop using the incentive spirometer. One of the greatest dangers to post-surgical patients is pneumonia. One of the most important things that you can do is to cough and deep breathe, and the incentive spirometer encourages you to do that. The incentive spirometer provides a visual effect that incites patients to inhale deeply. Thank you.